First thing I'm gonna do is I'm gonna take a 3D x-ray on you, what we call a cone beam radiograph. That's what I can see your teeth, the infection if you have any, the quality of bone, how much bone you have. That's how I can diagnose, are you a candidate for implants? I wanna start with that because I firmly believe that if you're here to find out about implants and we don't take that x-ray first, they're just trying to sell you a product. I need to know if you truly need this before I even start talking about it. So we always start with the x-ray so I can diagnose it. While I'm reading the x-ray, Chris will bring you into our consult room. Chris is our patient coordinator she's gonna take care of the steps for you of financing and getting you ready for surgery. And I'm gonna come in, I'm gonna talk to you about where you're at. Everybody gets to this point for different reasons. And it's my goal to meet you where you are. No matter how you got there, periodontal disease, broken teeth, cavities, a car accident, whatever it may be, my goal is to bring you from where you are to where you deserve and desire to be. That's what I call the new you smile. We'll talk a little bit about your wants, your needs. That also comes into play about financing. Not every patient needs both top and bottom full set of implants. We'll talk about what works for you. Once you say, I'm ready, and you say it's time to go, we can sometimes even start what we call our records appointment that day. I need to find out where you are and how that's gonna fit where my implants are gonna be later. So that records appointment's pretty simple. We have a 3D scanner. We're gonna have you sit in front of the scanner. It takes a simple picture of you with a smile. Now I have a 3D replica of your head. Then what we have is another little scanner that's a little wand that we spin around inside your mouth. No shots, no anesthetic, it's an easy appointment. We map that as a 3D replica of your teeth onto the replica of your head, onto that 3D x-ray that I took at your consult appointment. Now I have all the information I need to plan your surgery. Surgery usually is about a week to 2 weeks later, depending on our schedule and your schedule. Surgery is roughly about 3 hours for most patients, if that's both top and bottom set of teeth. We're gonna give you some sedation, put a little IV in your hand or arm, really simple, let you fall asleep, do the surgery. As you're starting to wake up from surgery, you're gonna see we're gonna start working on your teeth right then. If I get good records at that first appointment, we're gonna have this beautiful set of teeth that we 3D print right here in our office that same day. About an hour after surgery's done, you're still kind of coming out of sedation, still a little groggy still, but you're waking up. We're putting your teeth in. You're gonna smile in that mirror for the first time with a new set of teeth that day. So surgery, 1 week, 1 month, 2 months, and we start making your permanent set of teeth. And from there, it's 2 more visits before we give you your permanent set. When you walk out of this office with that permanent set of teeth, I want you to think, this is my new smile.